So here we have one of the latest and greatest diagnostic instruments for an optometry or ophthalmology practice. The AcuTarget HD is a 4-in-1 diagnostic instrument. It measures forward light scatter in the eye, which measures quality of vision through an OSI scan. Secondly, it measures a tear film analysis to understand how a patient's tear film or their dry eyes is affecting their quality of vision. Thirdly, it can measure accommodative demand, or how well a patient can focus from far away to up close. And the fourth attribute that's really great is that it can, for the camera inlay or for inlays, mainly the camera inlay, it can evaluate centration preoperatively and postoperatively to allow a surgeon to understand if they place the inlay in the correct position to optimize the patient's outcome. On this screen here, you can see all of your measurements that you've been taking on the patient. This is a patient profile. You can select your test and then open up the test to evaluate the results of the patient. And what you can see here on this screenshot is the ocular scatter index score, which here you can see is a 1.8. And this tells you about the quality of a patient's vision. It also gives you a scale down below, which tells you from green, yellow, or red, the level of vision that the patient has. Good vision is usually below 1.2. As you start to get above that, the quality of vision score does go down. And this is used to assess if patients have cataracts and the level of their cataracts. Can also be used to evaluate corneal disorders or dysfunction of the cornea and how that's affecting the quality of a patient's vision without even asking the patient one question. On the left, you see what a perfect optical system image would look like and what that retinal image would look like. On the right, you see what the patient's quality of vision is and what their retinal image looks like. So it's a very nice output to be able to show patients that they can easily understand and comprehend about the quality of their vision. The nice other feature that you see down below is the predicted visual acuity. Now this one is different than the visual acuity that you would measure in an exam lane, and that the predicted visual acuity is based solely on the optics of the eye that the instrument measured. So it's telling you how high quality of an optical system that that patient has in their eye, and it will give you their predicted acuity based on just the optics of the eye. And then you can use that to help narrow down your differential diagnoses to figure out if it's a retinal problem, a neurological problem, or if it is in fact something to do with the cornea or the lens that's causing a decrease in the patient's vision. What you're looking at here is the output of another test that the AcuTarget HD features. This is what we call a tear film analysis. So during this test, the patient's asked to focus their eyes and not blink for 20 seconds, and the instrument's evaluating how stable their tear film is during that time frame. It's the only diagnostic instrument of its kind that can measure the effects of tear film on a patient's quality of vision. So as a doctor, I can understand, is their dry eyes affecting how well they're seeing, or is it not? In this particular patient, they have a pretty flat line quality of vision during the tear film analysis test, which tells me that their tear film isn't interfering with their vision whatsoever. In patients that would have meibomian gland disease or tear film that is affecting their quality of vision, like a lipid disorder due to meibomian gland dysfunction, you'll see these ocular scatter scores increase over the first 5 seconds of the test. And these are patients where their tear film is absolutely affecting their quality of vision. So another feature of the AcuTarget HD, which separates it from the regular HD analyzer made by Visiometrics, is that the instrumentation with this software allows you to analyze the landmarks in the eye, mainly the pupillary center and the Purkinje image, in order to establish if the patient has a large angle kappa. And this can help doctors and refractive surgeons understand not only to where to place their refractive treatments like LASIK, but it also allows the doctor to understand and plan for their positioning of where to put the camera inlay. This also has a post-operative module where the instrumentation can measure where the camera inlay is located relative to these landmarks to inform the surgeon if they place the inlay in the correct or optimal position for that patient. So although there's a lot of advantages to this instrumentation, there are a couple of cons. One is that the instrumentation does not come with a hands-free mouse, and I highly recommend that your staff goes out and buys a mouse to use with the instrument as we have here. It makes measuring the patients a lot more quickly. Secondly, when your staff is printing out the individual evaluations, it doesn't print out all the evaluations all at one time. You in fact have to print out each measurement individually for the different types of scans that you did. So a nice feature would be able to print them all out all at once. That would make things a little bit more quick and easier to use for the staff. But I think that's coming out in the next software generation. So another disadvantage to the instrumentation is the patients need to have their ametropia corrected if they do have a prescription in order for the test to be run correctly. If patients have a pair of glasses, they can wear their glasses during the test, or you can put trial lenses into the instrumentation in order to correct the patient's vision. Sometimes this can be cumbersome if the patients have a very high prescription above -6 or above +6 to use the trial lenses. So that's one disadvantage of the instrumentation. It would be nice if it had the ability to correct all of the prescription on its own, and it also does not have the ability to correct for astigmatism, so you definitely would have to place their astigmatic correction inside the lens wells or have them wear their glasses.